Hello, I am Dr. Chethan G, consultant gastroenterologist, Narayana Multispeciality Hospital, HSR Branch. Today we are going to talk about fatty liver. Most of you might have heard about fatty liver. Nowadays, it is commonly talked subject. Everybody knows about fatty liver. So, most commonly asked question is, what is fatty liver? So, fatty liver is accumulation of fat inside the liver. We call it as fatty liver. Most commonly we see is alcoholic fatty liver disease, that those who consume alcohol, we see alcoholic fatty liver disease. But there is a entity called as non-alcoholic fatty liver. Those who doesn't consume alcohol also develop a fatty liver, that we call it as non-alcoholic fatty liver disease. So in a general population, when they say fatty liver, what they mean is non-alcoholic fatty liver disease. So but fatty liver has two types. One is alcoholic fatty liver, other one is non-alcoholic fatty liver. So why does liver will have a fatty liver? Even those who doesn't consume alcohol, is you may have some risk factors. If you are a obesity, if you have a hypothyroidism, if you have a diabetes, if you have a dyslipidemia, that is high cholesterol and triglycerides level in blood, these are all the risk factors to develop a fatty liver. And there are certain medication also which may cause fat to accumulate inside the liver. What are the symptoms the patient might develop because of fatty liver? Most of the patients are asymptomatic. They will not have any symptoms. Incidentally, they do ultrasound for some other disease and you find out a fatty liver, or they do routine blood investigation and they notice some abnormality in blood test and we label them as fatty liver. So most of them are asymptomatic. Some people might have a vague right upper quadrant, right upper abdominal pain, or they might have a decreased appetite. If this fatty liver is neglected and is progressed to a next stage where the liver becomes scarring, they develop a fibrosis and they progress to cirrhosis. Once the patient develops cirrhosis, they may develop jaundice, they may develop ascites, that is accumulation of fluid in the abdominal cavity, or pedal edema, and some people may also develop a liver cancer. So fatty liver, around 8 to 10% of the population might progress to cirrhosis, and once the cirrhosis develop, they may develop a cirrhotic related complication and also they may develop a liver cancer. But majority will be asymptomatic and it won't damage. But at the same time, we should not neglect fatty liver. So next question is, how common is fatty liver? Roughly around 25 to 30% of general population is having a fatty liver. But if you are a diabetic, there is a 50% of chance you might be having a fatty liver. But as the risk increases, if you have a diabetes, hypothyroidism, dyslipidemia, there is a high chance you might develop a more complication. So how to diagnose? Diagnose, once we usually ask for ultrasound abdomen, that is abdominal scanning. Then we ask for liver function test, and we also want to look your fasting lipid profile, hypothyroidism, and hepatitis B and C virus you may get test. And there is a new diagnostic modality called as fibroscan, where we can assess the liver damage without doing a biopsy. Based on these blood investigations and ultrasound and fibroscan, will decide whether you need a treatment or not. So drugs, there are a lot of drugs are there to treat a fatty liver, but most important is the lifestyle modification. Lifestyle modification means you have to reduce your, if you are obese, you have to reduce your weight. Daily you have to walk for 30 to 35 minutes, you have to walk, consume fresh fruits and vegetables, you should avoid junk foods, carbonated drinks has to be avoided, and the comorbidity has to be under control, that is diabetes, dyslipidemia has to be under control. And weight loss, it should be like approximately you should around 10% of weight loss you should lose over 6 months. So main focus of our management is on the lifestyle modification, but there are certain drugs, but it is a secondary. So most important is lifestyle modification. So try to have a healthy lifestyle. Thank you.